Welcome to The Explainer. Today, we are digging into the NHS budget. It's bigger than it's ever been, which, brings up a really simple but incredibly important question. Where is all that money actually going?
So the annual budget for the NHS is now sitting at over £200 billion. It's just a staggering number. And to put that into perspective for you, our sources show it's more than doubled in cash terms since just 2012. It's a level of spending that's been fiercely protected and even increased by one government after another.
And right there, that's the paradox that's at the very heart of what we're looking at today. I mean, if the funding is at an all-time high, why does the service feel like it's struggling more than ever? Why are performance and, public satisfaction just hitting rock bottom? Okay, let's really dive into this, because the sources paint a pretty stark picture. It's a system where throwing more money at it just doesn't seem to automatically mean better results for the taxpayer. On one hand, you've got this huge, ever-growing budget, but on the other, public satisfaction is plummeted to its lowest recorded level. A massive 71% of people are now rating services as bad.
So to even begin to understand this paradox, we have to follow the money. And we're going to start with some of the most direct, most quantifiable leaks in the whole system, a trail of incredibly expensive programs that just haven't delivered.
Let's just start here. £8.7 billion. That's the value of personal protective equipment. We're talking masks, gloves, aprons, that was written off in a single year, 2021. And the official reports say this was because it was either faulty, totally unusable, or it had just expired before anyone could even use it. That's £8.7 billion. Poof, just gone.
And next up, another huge number, £4 billion. Now, this was the cost of the test and trace system by October 2020, which was largely outsourced. This was a program that the Public Accounts Committee, that's the group that scrutinizes government spending, they concluded it had failed to deliver on its main objective, a £4 billion failure.
And well, this figure is truly mind-boggling. £80 billion. This is the projected total repayment bill for just £13 billion of hospital investment. These are built under something called the Private Finance Initiative, or PFI schemes. Now, that's where private companies build and manage public projects. The National Audit Office found these schemes were not only more expensive than just using public money, but they also failed to transfer risk effectively. So, think about that. We're on the hook to pay $80 billion for $13 billion worth of investment.
So here's the really crucial point. This isn't just a one-off issue. It's not a single bad decision. The sources we've looked at document a consistent, decade-long pattern of high-cost, high-profile programs that delivered extremely poor results, costing you, the taxpayer, billions and billions of pounds.
All right, let's move on from those big, obvious leaks to something deeper, something more systemic. It's a problem the reports call structural churn, and it turns out it's a massive engine for hidden costs and inefficiency.
So what on earth is structural churn? Well, imagine the NHS is on a constant treadmill of reorganization. The system is always changing. They're creating new organizations, merging them, and then dissolving the very bodies that are supposed to be delivering services. This endless cycle makes it incredibly difficult to come up with any kind of effective long-term plan, and it just burns through huge amounts of money on admin instead of actual patient care.
Now, what's really fascinating is when you compare this whole thing to the private sector. When private companies merge, they're at least held to account by market discipline and their shareholders. But in the NHS, major reviews by groups like the King's Fund have found that these mergers are rarely justified, they often have no strong evidence behind them, and they almost never actually improve clinical care for patients.
This constant reorganization, this churn, it doesn't just create confusion and waste. It also swings the door wide open for another major financial drain, the massive growth in outsourcing services to private for-profit companies. Since the Health and Social Care Act of 2012, this is the total amount of public money that's been allocated to non-NHS private providers. £125 billion. Just flowing out of the public system and straight into the private sector, and often with very little transparency about where it all ends up.
And what this has done is create a pretty stark divide. Getting timely access to healthcare is increasingly dependent on what job you have, specifically whether your employer gives you private medical insurance or PMI. This is creating what's effectively a two-tier system of healthcare right here in the UK.
And just look at this table. It illustrates the inequality perfectly. High-paid technical staff, say in finance or tech, they often get comprehensive private cover. It allows them to just bypass NHS queues. But essential non-technical workers, we're talking about cleaners, supermarket staff, care workers, the very people who keep the country running, they rarely get this benefit. And that leaves them completely reliant on an already overstretched public service.
And you might think, well, at least the market for this private insurance is competitive, right? Wrong. It is completely dominated by just a handful of major players. As you can see, the reports show that just 4 companies, Bupa, AXA, Aviva, and Vitality, they hold over 95% of the entire market share. That gives them immense control over this growing sector.
So what's the real-world impact of all this? The financial waste, this constant churn, this growing reliance on outsourcing? Well, the cost is far, far greater than just pounds and pence. The data shows a direct and honestly devastating link between these systemic financial problems and the pressure on the front line. Waiting lists are at 7.5 million. There are over 100,000 staff vacancies. Coroners are issuing hundreds of reports on preventable deaths every single year. And the bill for clinical negligence? It has ballooned to a staggering £60 billion. This is the real human cost.
And this right here, this is probably the single most important takeaway from this entire analysis. The problems we're seeing, the waste, the delays, the harm, they aren't just caused by a few bad decisions or a couple of individual mistakes. They are the predictable, almost inevitable result of the very structure of the system itself.
And that leaves us with the final and most provocative question that our sources pose. In a system where tens of billions of taxpayer pounds are lost to documented financial waste and structural failings, where does the accountability truly lie?